Hi everybody, it's Dr. Bingham here at Compass Chiropractic, and I've got Aaron helping me here with some demonstrations we're going to be doing with joint manipulation. We're also going to talk a little bit about some hip and spinal manipulation as this all relates to plantar fasciitis. So this is part of a blog post and an informational series we're doing on different conditions. This one in particular we're doing is going to be about plantar fasciitis. Now, I'm not going to go in detail about what plantar fasciitis is through this video. We've got part of this blog post is a detailed description of what this is. If there's anything that I'm going through and you have any questions, I'll make my email available. It'll be you'll see it here on the video, or you can contact our website directly and send an email directly through the website. So, if you've read the rest of the post, you've probably seen that there's a number of things we can do to treat plantar fasciitis. One thing I want you to get in your mind is that a lot of times it's not just where the pain is. Now, most of you have probably heard of tendinitis. Anytime you hear itis, plantar fasciitis, anything that has itis after that name means that basically you've got some inflammation, and that's a symptom of a problem. Now, to think of your car, if you came out and you looked at your car and you saw that you were wearing your tires out on one side, you wouldn't go over and say, "Oh, I've got tire-itis. I've got a problem with my tires." You'd say, "Well, there's something up the line that's causing the problem." Now there is a problem at the tire level, and that needs to be addressed, but you've got to figure out why. And that's the big question for me, is trying to figure out, well, if someone has plantar fasciitis, is it just because they have, the way they walk, their footwear? Is it coming from their ankles? Is it coming from their knees? Is it coming from their hips? Is it coming even higher up than that? So we address this a myriad of different ways, and in this video we're going to be looking at how we address it through joint manipulation. So when we check the foot, there's a few things we look for. One of them to make sure that we've got proper dorsiflexion from side to side. Now, dorsiflexion is this motion here. It's how far your foot can come back up. Now, if we find that one side is deficient in that movement, that dorsiflexion, this could be coming from tight calf muscles. It could also be coming from the joints in the front part of the foot. Now, since we're going to address some of the soft tissue therapies in the other videos and part of the text, I'm going to talk more about the joint manipulation here. For decreased dorsiflexion, what we do is we contact at the very top part of the foot, and then there's a pull that comes through here, and it's a quick pull that drops down like this. Typically you'll hear a little bit of a pop as that drops in. We won't always hear that. From there, we look at all the other ranges of motion. We look at eversion, inversion, see how those motions are. If we see problems there, that may be coming from the heel bone. There may be restrictions in that area there. We may also see that, and this is going to move us up into the knee, that we've got restrictions in what's called the fibula. This is the little bone that, if you've ever looked at a skeleton, you'll see the big leg bone. You also see the little one that runs along the side. That's this bone here. This is the bottom of it. This is the top of it. So if it becomes restricted, the foot won't move properly into pronation, which is the rolling in of the foot, and then it'll lead to extra stress on the foot. So we might mobilize that. That will look more like this. We can also come through here, put more pressure like that. We can use more of a quick motion like we did with the other, or we can mobilize back and forth to get that motion. Now, because this bone runs all the way up into the knee, we may want to address it up through here. So one way that we can do that is coming up here, contacting over the outside of that same little bone there, and then we use contact here to mobilize that spot. Now, we may also notice if Aaron's walking, or even if he gets on the table and his leg flops out like that, more than likely when we see this, it can come from the ankle. Sometimes if this motion isn't happening, he'll learn to turn his foot out to get over his foot because it's getting stuck. But if we see the whole leg out like this, a lot of times we're seeing a problem that's coming higher up into the hip. And that's where we would look at adjusting more of the pelvis, the low back, seeing if there's any imbalances with the muscle strength or tightness. And a lot of times we'll see there's hip instability and that the body's trying to stabilize it by tightening up the wrong muscles. So at that point we'll give him exercises, stretches, things that he can do at home, along with the manipulation and the adjustments that we do to the lower back and the hip. So this is just to give you an idea of how we would treat this through using joint manipulation. In the other videos, we'll talk a little bit more about some of the soft tissue therapies that we do and address even some of the kinesiotaping and other options that we offer for correcting plantar fasciitis. Thanks for watching.